dental.
I love that.
Yeah.
Okay, so here we are. Here's Joy Moeller. I mean, whoever is watching this, you probably don't need to know who Joy is, but if you're with me and you're seeing my things and you don't know Joy, she's one of the most renowned myofunctional therapists. She's going to tell more about herself, but is a registered dental hygienist, and then deep dive into the airway world and myofunctional therapy, and is down here in Pacific Palisades where I am at right now. I had the good fortune of coming to visit her on this LA trip, and we're just going to talk about her world and my world and how they converge. But we definitely want to talk. We're going to be excited for Joy to share more about her book, and some exciting things that she has coming up with it. But it's already, for those of you who've already read it, and who know Joy, you would consider her one of the predecessors for, and the teachers and the mentor for you all. So, well, I'm excited to be here, and thank you, Joy, for welcoming me to your office. And we've done some body work, and we've had some time to talk.
I can move. So I'm very impressed with your work on the floor of the mouth and how to get a diagnosis of what the rest of your body is doing. And I've known for a long time that there's a connection between the tongue and the rest of the body and the functions of the tongue. But I never thought about the floor of the mouth in the same way.
Mm.
And I will from now on, because of what you showed me about my own body.
Yeah.
From looking at the floor of my mouth and adjusting that.
Well, I appreciate you letting me check intraorally and then check your body. And so, and for everybody, it can be different, but you've had some really clear connections with the floor of the mouth to certain organs, and we just saw some good change. So
Yeah,
I'm excited about
can
that.
move.
Yeah.
So I'm very impressed and excited to have you here.
Yeah. Well, thank you for having me here and for letting me set up my equipment and get this started. So
Yeah.
the fact that we're here talking is already beautiful, but I definitely want to just explore. And there's so many kind of keywords that I'm talking about. Really, this is a conversation with Joy, and you're an expert, and I want you to just share. And I think people will benefit from hearing anything you have to share. My kind of umbrella term for this podcast is compromise to alchemize, but really it's just about going from compromised to alchemized, and by that I just mean healing, on the pathway to healing, and through tough stuff, and through things that have probably been there for a long time, and or they have constricted us. And because we are people, we have those. We just got to work on your body and see what's been ailing you, but you've also, countless people you've guided in healing. And so from that perspective, I would love to set this up as you've guided many people through from suffering to feeling better.
Right.
And that's the process I'm talking
That's
about.
the key. I love it. And there's nothing better in the world. It's helping someone live a more productive, pain-free life. Nothing.
Yeah.
Nothing you could ever do. You could travel to the highest mountains or the deepest seas and do the sports, but helping someone else over time, I love it. I've been doing it 44 years.
Wow.
Long time. And it's all about chewing, breathing, and swallowing correctly, and how to identify issues that people are not aware that they have, and how it can affect their whole body, including their mental capacity, physical, emotional, spiritual, every aspect.
And you were telling me about this person that had 6 or 7 jaw surgeries. Is that a good one to talk? I want you to talk about whoever or general, but is that a good one to talk a little bit about?
Well, it's an example. I've had many patients that have had jaw surgery. I had jaw surgery myself. I'm not against jaw surgery, but I think we need to look at the why, first. Let's look at what caused a person's jaw to grow and look at how to work with that both before and after. otherwise, if you just keep treating the same issue over and over again and expecting a different outcome, that patient from all the surgical techniques can be in trouble from the trauma of all the surgery. So always look at the cause first, and then work with that.
And if you, and I mean, you said that, you said it, and look at what caused the jaw issue. So just for the sake of, and there's going to be a lot of people who are either follow me and you are seeking airway help. If you're not a practitioner, then some of these things you might wonder, well, what does she mean by that? Would you elaborate on any of that? Like,
Well, it's I'd say the number one cause is civilization, because we've gone from
and you said civilization?
Yeah.
Oh, yeah. Okay.
it's we've gone from breastfeeding and eating natural foods that you grew yourself, or
Yeah.
not a lot of plastics. You know how I feel about plastic.
Oh, yeah.
I think plastic is causing our fascial tissues to become plastic.
Yeah.
And I know we eat the fish eats the bottles, and so on and so on. So how can we deal with that is to look at these tissues and try to release them or get them to function as well as we can.
Yeah.
And swallowing, chewing, and breathing properly. But the way babies are being fed, with bottles, and what's happening with baby food, they're not chewing, their jaws are not developing correctly. No one's really looking at the way they breathe until it becomes a problem. I know a funny story. I was getting my nails done, and there was a mother holding a 3-year-old next to me, and the 3-year-old was going like with a tongue out, open mouth, sitting there. And I looked at her, she looked at me and smiled. And I said, did you know your nose is for breathing and your mouth is for talking and eating? And she went like that. And I said, yeah, you should breathe through your nose and your lips should be closed. And she immediately closed her mouth. And the rest of the appointment for my nails, she was breathing through her nose. And the mother looked at me, and I said, no, your daughter, you need to teach her that, her nose. She said, well, ever since she went to nursery school, she's been sick a lot. I said, I know, but you get better, and then you have a habit of breathing through your mouth. And that's what needs to change, because otherwise everything in her mouth is going to not grow right.
Yeah.
And the mother said, I didn't know that. And it's the same thing with TMJ problems. People go and they have jaw pain, and sometimes they wear a splint in their mouth, or the dentist does an injection and to help. But nobody's looking at why do they have a TMJ problem.
Yeah.
We have to look at the cause. Are they chewing on one side? Are they sleeping on one side? The mandible is a floating bone. And if it moves too far, you have a slip disc or a pinched nerve. And all people have heard of pinched nerves and slip discs, but they never kind of equated it.
Yeah, I don't think about it for the jaw much.
And I know we're doing a lot of jaw joint replacements now because the condyles have worn out and the bones have disintegrated.
Yeah.
But even if you get a new jaw joint, if you haven't looked at what caused the jaw joint to deteriorate in the first place, then you'll have problems with the new jaw joint.
Yeah.
So I think that whole cause and effect thing has been kind of swept under the the rug,
Yeah.
because there's a lot of people selling equipment and having, their universities prescribe different procedures, but it's always to do with function and form.
Mm-hmm.
So you need both, and you
Yeah.
need to be able to collaborate. That's
Yeah.
why I'm on the board of the AAPMD, the
Mm-hmm.
American Academy of Physiologic Medicine and Dentistry. I've been on the board for over 10 years, and we're trying to bring together physicians, dentists, chiropractors, physical therapists, everybody together, and myofunctional therapists to work together. Like, I think of speech therapy and how wonderful speech pathologists are in helping, but they're not taught in school anything about myofunctional
Mm-hmm.
therapy yet. We're
Right.
working on
Right.
it.
Yeah.
It should be in every speech program.
Mm-hmm.
It should be in every dental program,
Yeah.
or dental hygiene. I mean, I was a hygienist, I still am, for many years. And I would be cleaning teeth and teaching a patient how to floss and brush. But unless you look at mouth breathing, you'll never really cure the disease. And that affects everything. Every aspect of dentistry is affected by myofunctional disorders. And I think it needs to be addressed in schools, and for babies especially, and mothers. I think it should be in the schools, like life education and junior high, how to prevent things, how to be the healthiest you, and how to
Yeah.
make the healthiest baby you can. So many people have babies that have colic and are screaming, and they don't get any rest, and so their sleep is affected terribly, and it kind of becomes a family problem then, because the father is sleep deprived and trying to work, or the mother is, and the baby is screaming in the night and coming in their bed at night. So we have to look at the cause and try to treat it as non-invasively as we can, without medications and surgery. I mean, those things are essential, but that should be the last line, not the first line of treatment. And of course, breastfeeding is really important. In my book, there's
Yeah.
a chapter on
Mm-hmm.
breastfeeding. I have 11 co-authors in
Mm-hmm.
here, a sleep medicine specialist, a cardiologist, an osteopath, orthodontist,
Mm-hmm.
pediatric dentist, and a breathing trainer, Patrick McEwen, who's
Yeah.
written many, many books.
Oh yeah.
Yeah.
This is great.
We recommend all of our students in myofunctional therapy to train with Patrick as well. Or there's also an organization called the BBEA, the Buteco Breathing Educators Association. You can find there are other people that teach breathing education as well. So
Yeah, so good. There's so many. I want to come back to the book, but I wanted to say, yeah, this is with lactation and myofunctional, very different, and yet I view you both in that field as lactation obviously for infants and the breastfeeding portion, and myofunctional for everything after. It's like I love that you care for I've talked about this before, where you care for the dyad. And that is that at least the mom and the baby, or the mom and the child, in the mom and the dad and the child, and then whoever else is in that relationship, in that family, that's a dyad or a triad, but it's basically a multi-person organism. And
absolutely.
Everything affects, and it's a loop, and it's a cycle. So I know I kind of want to go right back to when you were talking about the plastics and how we were talking about that, whether it's the environmental toxins like plastics or metals or whatever else is out there. I know as a parent of a little ones, 3, and then
I
my
know,
own journey,
3.
it can be so overwhelming to consider that. And I've done deep dives into that, and I've spent time with somebody who's one of the most renowned teachers on the way plastics are affecting our bodies. And boy, I will say that I came out of that conversation the most informed and for a moment really depressed. Then I got happy again because I realized, you know what? We can do things to help. And I really feel like not everybody can have that hope though. Some people get overwhelmed and they're like, well, what do I do now? So I think in one way, I love that, like especially with what we're talking about, a myofunction, an orofacial myologist, a myofunctional therapist, you're like a bridge, a liaison, an
Exactly. Bridging the
advocate, and a
gap.
support. So when you're taking care of one or a dyad or a family, you can soften the blow of some of these stressors to say, look, all these things are going on, but let me see what we can do with some of these, with all of what you do. And also when it's right and when it's time, yeah, let me direct you to maybe somebody else who can do what you need in terms of these other
It's all
adjunctive
about
therapies. So the
collaboration.
collaboration is
It's
huge.
it's essential
Yeah.
because I learned today about all the ways you use the floor of the mouth to diagnose everything in the body that's going on.
Yeah.
And I've known for many, many years that the tongue is probably the least diagnosed, most important organ because
Mm-hmm.
it's an organ. It has
Right.
many muscles inside. It's not a muscle,
Yeah.
but I never thought about using the floor of the mouth to diagnose different organs and muscles and meridians and everything else that goes awry. Fascinating. It's
Yeah.
fascinating. And these little pearls, are not taught in medical school
Mm-hmm.
because there's not enough time, they think.
Mm-hmm.
But certainly, what I always recommend my students to do is to go to the schools, anywhere where there's a medical school, dental school, speech school, dental hygiene school, PT school, OT school, and do a lunch and learn. And they're looking for free lunches, the
Mm-hmm.
students, but we have to open their mind to this other world. They're not ready because they're trying to study for the test and get their license and everything, but
Right.
it will infect them enough if you can have like a presentation where you show the different uh, before and after videos and pictures to like, oh, I learned about that. And I did that for a long time here at
Mm-hmm.
UCLA and USC. I would go in and do a little presentation and, work my way into the programs. And that's paid off because a lot of those people that were in those classes have graduated and then remembered, oh, when I was at school, yeah, I remember a little bit about the tongue. But it's probably the least diagnosed, most
Mm-hmm.
important part of the body. And doctors are being trained and not knowing much about it. And it's sad. And it's frustrating. And then you add the pesticides and the
Mm-hmm.
chemicals and the plastics and the things in the air that we're breathing. And it's just causing a lot of stress. And then you add technology with the EMFs and
Mm-hmm.
all the other things that we have to shield ourselves. We have to look at ways of protecting ourselves more and more. And it becomes like an OCD thing pretty soon. You start worrying, well, my neighbor has their television on. Am I getting the radiation or whatever from that? And the blue lights from the street lights. You need to have room darkening shades so that your body can sleep deeper, get into REM. There's so many things that, it's an ongoing learning just to survive. And we're facing extinction. I told you, uh, Kevin Boyd and I talk about that a lot. If we don't take a 90-degree turn pretty quick, starting with breastfeeding, starting with bonding, starting with the mother and the connection and the father, even holding the baby. I think not enough people are holding their babies.
Yeah.
And I heard one doctor talk at a convention about the palm of your hand is made for the baby's head. And it's almost like a cranial adjustment that by just holding the baby properly can make a huge difference. And much less breastfeeding to develop the mouth properly.
Yeah. One of my favorite things to do is, or my heart really comes alive at getting to be a place for families to come and, for moms on their pregnancy journey and then postpartum, bringing their little ones in, and we can check these newborns for any misalignments or, cranial tension
as soon as possible.
So whether I always say, take it easy. If you don't need to go, just relax and, but as soon as you need it, I'm here. So we always save spots. I always reserve spots, especially for pregnant moms and for, postpartum for babies, so that there should always be a spot available that week until, a certain amount. But because I used to book out 6 months in advance, and then I would have these people would, all the birth workers, the midwives, the doulas, they would refer to me, and I'd say, oh, I just can't get them in because I was stacked. So it was years ago that I said, that's just not right. How am I saying that I'm taking care of these people and I'm not making space for them? So my assistant and I worked on charting that out. And so every week we would not release certain appointments until that week, the beginning of the week, so that any cases that came. So now wonderful. I dedicated to my whole schedule. For the majority of it is pregnant moms, babies, and then airway issues, much to the pain of my patients without those issues. But as I'm finding out, I'm like, so many of us have these issues, and they might not have a tongue tie, but they have orofacial issues that need help. So first of all, I love collaborating with the myofunctional therapist in our city in Reading. But ones like you, we have, and of course you have so much expertise over the decades, and it's like, there's so much we can do that is, like you said, non-invasive and gentle and potentially change someone's life and preventive. So I kind of wanted to say that I think that's what people are looking for. They're like, yeah, I know I might need to do all these processes, but I think they're overwhelmed, but I think that they really but they need help. So I think your book's a great resource for that. And also just people nurture, just what you were saying, nurture and nourishment. It's like we need that, and people need that more than ever, is care, nurture, nourishment, which could look like you teaching somebody how to move their mouth and the floor of their mouth and optimize their function, because that is a very gentle way to nourish and nurture by getting more oxygen and chewing to digest foods. So anyways, I think I love that.
I think the awareness is what's critical. I know years ago I heard a public health nurse talk in London who wrote a book called Baby-Led Weaning on the importance of getting rid of the baby food and having the baby eat whatever mom is eating, and they chew on it and they develop their jaws. Little tools like that can change baby's life. And if you do it at the right time, like 6 months, as soon as they can sit up, as soon as they can pick up something and put them in their mouth, they're ready for eating food, not baby food. Because baby food teaches the baby that all they need to do is put it in their mouth and swallow. And so then their formative years, they don't want to eat a carrot, or they don't want to chew anything. All they want is pasta, anything like smoothies, anything that they can just put in their mouth and swallow. And they lose that ability to chew. And chewing is critical critical for so many things to get the right organs in your mouth, the glands to secrete the right enzymes that break the food down, and everything is just a problem then with digestion. When they swallow air, their tongue doesn't work. So when they swallow air, they are constantly having belly aches and pain, and all those things distort the psyche, the personality. When kids don't feel good, then they act out aggressively sometimes, and they're not sleeping, and they're just out of sorts. And think of all the turmoil in the world today that we're having. Can all be short circuited with the right childhood, the early development, and prenatal care is critical too. Moms, whatever they eat, that's going right into their new baby. So they have to think more. It's not, I know when I was pregnant, it was just, well, you have to not drink as much. That was, but nobody said, they just said you can't gain more than so many pounds. But they didn't tell us that we had to be on a really strict, good, healthy diet with protein and vegetables and all the things we need.
You were mentioning, the which is nourishment and the need for all the nutrients that we need. And I was thinking about that in a different way. And I was visiting this family, sweet family, yesterday. Met them for the first time, and talking. And the 4-year-old little girl was precious, and she was looking for like deep, like connection, and she was just it looked like she's kicking dad. They're playful, right? She's kicking dad, and he's like, I didn't get her to the park because we didn't go to the playground to get out that energy, right? And while that's true, we need all of that. We need outside time, and I have 3 little ones. They told me a little bit about the story, but I could feel her sphenoid was misaligned. I can feel it in my head, really tense on this right side. So, well, anyway, because I know that's one of the points that I categorize in my tongue tie or airway map, 70 points in the body that are often accompanying this floor of the mouth tension, anywhere from the sphenoid is misaligned to the right, and then, to get specific in that region, then we'll see often the lacrimal on the right, the ethmoid, and the zygomatic. So that this fits like 99 out of 100 people and the thousands of people that I've seen. But anyways, I went up and I said, you have this button on your head. Do you know that? And she said, it's just silly, right? She's playful. So this little 4-year-old, see, this button right on your head. And I think if I can go up and just turn it on, it's gonna help you feel better. She wasn't saying she felt bad. She was intrigued. So I went up and I went up behind her, and then I just right there on that sphenoid. And then I made it playful. And then she just went and melted. And she just sat there for a minute. And that's a long time. And then her dad and her mom were looking at her, and then they're like, oh yeah. And then I started to shift something else. And I took my hands away, and she's like, more. And she grabbed my hands and put it back. Of course, she was looking for feedback of any kind, but that was the button, so to speak, that unlocked what I know is this whole process that goes in. So it was such a good thing, is like we can sometimes, in that moment, I thought, oh, I want to do a full evaluation. I'm like, you know what, if I just do that one thing, it might help a little bit. And it was her bedtime, so it was like good, because it helped settle her for her bedtime process. Wow. But I just love that, these are families, so many families that come into me or that reach out to me, they're like, I'm doing this and this and this and this, and I'm seeing so many people on the team, on the collaborative team that you're talking about. There's a lot of the world that doesn't know the collaborative team between the myofunctional therapists and these other providers exists. So it needs to be talked a lot more about, like you're doing. But I kind of get the people who have doing all that, and they're partnering with people, but they're like, I just feel like this is so much, and I'm trying to see what can I focus on. And I'm like, yeah, I hear you. I understand. Just focus on the main things. And I mean, so much of the time, that's this, relationship with you or relationship with the lactation consultant as the point
Yeah.
person to help
Mhm.
check in with their emotions and also just what they need, which I love.
There's so much birth trauma out
Yeah.
there now too. Going through birth is difficult, and then not being able to crawl and do all the things they need and latch. It's just we've taken away so much of what Mother Nature has been an innate form of connection
Yeah.
with the child, the parent-child connection. And also, there's ongoing trauma. Kids, yesterday, one of my grandkids, a 4-year-old, got hit with something and he had a big mark on the side of his face. And we FaceTimed while they were having dinner. And I thought, what happened? Oh, she hit me with a golf club or something, the older child. And I'm like, you need to see somebody right away, soon, because I could tell the look in his face. He wasn't a happy camper. And this kid's always happy. So we do need to collaborate and reach out to the chiropractor, osteopath, body worker, whatever you want to say, to help, put things back together. It's like Humpty Dumpty fell off the wall. And
Yeah.
we got to have a way of monitoring these little falls and aches and pains. And I think the child's too young to go and tell mommy, my head hurts.
Yeah.
Right there. The mother will say, oh, just drink water. I see this a lot. You're not drinking enough water.
Yeah. Right.
You're dehydrated.
Yeah.
And the kid doesn't go to mommy anymore because they know that she's going to say you need to drink water and that'll fix it. And it doesn't fix it.
Yeah.
So they just get tired of it. So they don't say anything, but they act out because of the pain. I see a lot of children that have chronic headaches, chronic jaw pain, chronic stomach aches. They're not sleeping deep, so they're sleep deprived. And they wake their parents up, and the parents are sleep deprived. And you have this whole family of sleep deprived, miserable people. And you're right about the myofunctional therapist, because we look at things differently. We look at function and how we need help. We need to work in a team. And that's critical, because I know I can't do it all myself. And I don't want to do it all myself anymore. It's too hard. Holding their hand through all the acupressure. I teach them for headache pain and stuff, whereas they really need an adjustment. They need somebody to work with on a collaborative level. And the fact that you work with the tongue is so exciting, because you're one of the first actual healthcare doctors that I know that look at anything to do with the floor of the mouth or the tongue. Some dentists are looking at the tongue more and more, and depending on their myofunctional therapist. But as far as physicians, it's not happening. Not happening. I shouldn't say not happening fast enough.
Yeah. And I think that's true. I've had probably directly, I don't know if I've had about 100 people that I've trained at some form or shape. Most of the time, they're craniosacral therapists and they're massage therapists, and they're sort of in that genre. Then I've had, next to that has been the DC, the chiropractors, the osteopaths, the physical therapists, and then some dentists, and a lot of them were beginning to work. Most of them start on the pterygoids, and that's where they focus, but they haven't worked on the floor. But then I see some who are working with the tongue all the time, and I'm saying this is a very niche and narrow, because it's getting more known, but I think it's still way underdone. And also, I see some people who are like, there's I think now we're entering into a time when, if we're collaborating, we're kind of, we have to maintain our separate fields for scope of practice and for all these reasons, and defer to each other. But at the same time, we're kind of melding into one provider that people can rely on for separate functions and areas. So I love the fact that for me, I'm no longer a chiropractor by per se. I'm an integrative airway and feeding chiropractor because I specialize in neuro. I love chiropractic, but I love osteopathy and I love physical
osteopathy.
therapy and I love all of
Osteopathy
that.
saved my family.
Yeah.
Because if it wasn't for Viola
Okay.
Fryman,
Yeah.
you know, I don't know where my family would be now.
Yeah.
Yeah. So.
And it's such an important thing because it's not well. So thank you for saying that my work is helpful, and then Viola's work is profound in your family history, and I think even though the floor of the mouth is the perspective that I look for, it's really like a gateway into what's going on with this person and how can we arrive at what's going to help them. So I think I'm excited to impart more knowledge as I go on that. But I want to, we have a few more minutes before we both need to go. So I wanted to make sure we got to, would you mind sharing, thoughts you had about your book? I know
Yeah,
you,
I wrote it because I would I I'm not a drinker, but I'd go home some nights after working with patients that were so misdiagnosed and had so many problems that I'd be so frustrated. I would sit down and write a couple of words, just a couple words, a couple words. It took me almost 20 years to actually write my part of this book, which is about half. And then I thought, well, I'll ask all my friends, people I know that are specializing in their field and how, like the TMJ dentists and the orthodontists, the pediatric people and the breastfeeding specialists and osteopathy, how important that is. And, I missed a lot. If I was to rewrite it, I would have a chapter on with chiropractors talking about the floor of the mouth or something.
I'll put you in my book if you would be okay
I'll
with
a chapter.
Yeah, there you go. Well, thank you.
Yeah,
that's cool.
But I think people don't read books anymore. They're not reading. You guys are not reading. So I did it in audio.
Okay, that's great.
And that was very timely and expensive as well. So it's out on Amazon and hardback, softback, Kindle, and audio. So whatever, and it's on all the different audio forms. So you can probably get it for free on most of them. So it's something people listen to while they're cooking or gardening or driving, especially in LA. Driving, takes a long time, and so they'll turn on their book of choice. And so I just want the information to get out there. It helped me by writing it, but I also encourage other people like yourself to do it because it's leaving behind a legacy.
Yeah.
And it will help people in the future too.
Yeah.
Because we're changing so quickly and we have to keep ahead of the knowledge that they taught in chiropractic school or medical school 30 years ago is completely different now. Everything in dental school, everything's different.
And you were mentioning thoughts about the cover. Do you mind sharing any of that?
The cover scares people so much.
We can.
And that.
And what is it going to be like? What are you thinking of doing?
The person who designed this first cover was my first editor, who taught editing in a university, and he also was a writer who wrote horror, mystery, murder.
There we go.
And so I was in a hurry to get the book out.
Understand that,
and he put this together. He said, how about this?
Well, you've been working on it for 20 years, so you got to get it out there, right?
I wanted to. Before I die, and I was going to conventions and everything. And so we
got it out there.
But I'm going to redo the cover.
Maybe get somebody who is a gardener, or no, I'm just kidding, who nurtures, right? Versus horror.
Yeah.
Oh, but that's great. No, that's exciting.
I wanted it to be like shocking,
right?
But now I want it to be nurturing. So there will be a new cover coming soon.
Well, that's wonderful.
And I have an Instagram page too.
Yeah, I'll make sure I add these resources so people can.
My
And so,
former administrative assistant uh, has taken on the job
oh, that's
of doing
great.
the Instagram for me and Facebook. All these things are important to get the word out to the
Yeah,
public, to make the public demand the service.
yeah,
And I know there's a lot of, it's my scope of practice, it's my
right,
scope
right.
of, it's everybody's.
Yeah, it's
you know,
everybody's.
It's everybody's. We
Yeah.
all have to come together, work together until there's a doctorate program or a master's program in oral myology or myofunctional
Which
therapy.
that's like clearly that would be the penultimate.
Oh yeah, it has to.
Which I know
It has to
because
happen,
I've
but it won't happen quickly enough
Yeah,
for me
yeah.
because I think we are facing
Well,
extinction. So right now we need all hands on deck.
all hands on
on deck.
well, let's see. Yeah, as we conclude here, I want to. You've kind of mentioned all the places, but I think there's these. Anybody listening, let's say if they're not a practitioner and they want to just ask you questions or reach out, and then we have practitioners or anybody if they haven't come across or been in touch with you, and the way that they can reach out are those two different channels, or just how would you recommend people find out more about you and get a hold of if they have any.
Well, I teach with the AOMT, the
Mhm.
Academy of Orofacial Myofunctional Therapy,
Mm-hmm.
and you could look that up,
Great.
aomtinfo.org.
Okay.
I teach with Samantha Weavers, my
Mhm.
daughter-in-law, and my son, who's one of the directors.
Great.
And that would be one way. Or you could look at my website, joymoeller.com,
Okay.
MOELLER.com. And you can look there. I practice in Pacific Palisades, California. We're in my office
Yeah.
now. And I'm still taking patients.
Great, yeah.
And I love what I do. And I see people on Zoom or FaceTime, but I prefer in person if possible, if you live close enough. It's Pacific Palisades is like next to Santa Monica and Malibu, kind of in the middle. It's part of Los Angeles.
Mm-hmm.
But if you can't come here, I have a patient in Prague right now, and Cambodia, and lots on the East Coast, and Texas, New York, everywhere. So.
Well, yeah, thank you for sharing your expertise with all of these people and with me. And yeah, well, I'm looking forward to more potential conversations and more collaboration. So I look forward to that. So let's say there'll be more. Okay. But for today, thanks so much for tuning in, and just know that you've definitely, if you're watching this and you're listening, there's a whole lot more that we could give. So I'm going to put resources in, and stay tuned. We'll do more.
Thank you.
All right.